Hello dearies, welcome or welcome back to the channel. If today is the first time stopping by, you are so wonderfully welcome. My name is Selassie. I'm a registered nurse, a registered public health nurse here in Ghana. In today's video, we are going to look at the types of nurses that we have in the country. This video is much needed, especially for those who are now getting into the system, so that you know what you are in for or the opportunities available for you. Yeah, let's dive right in. Starting from the entry level, we have certificate, diploma, and degree. So the certificate programs, you should know by now that we have nurse assistant clinical and nurse assistant preventive. Then focusing on nursing alone, we have registered general nurses, public health nurses, and then registered mental nurses. And these three basic programs, you can do it at either the diploma level or the degree level. So you can start your career with diploma RGN or degree RGN, diploma public health nurse, degree public health nurse, diploma mental nurse, degree mental nurse. They are all basic programs, okay? So after the basic program, then you can do a post-basic program or a specialty. So the next group of nurses are the specialty or specialist nurses. And they are specialist nurses because they are focused on one area, either one area of the human body or one aspect of care. The basic programs is general. If you are a general nurse, you take care of all sick people, whether they are in the hospital or in the community, you do. The public health nurse, the same, like you are not focused on one area. But with specialties, you are focused on either one aspect of the human body or one area of care. The first group or categories of nurses that I have grouped myself are the specialties or types of nurses that focus on a specific part of the body. So number one will be ear, nose, and throat nurses, or ENT nursing as we commonly call them. So you see, an ear, nose, and throat, they are linked. So most times when you have itching in your ear, your throat will itch and all of that. So these nurses take care of people who have trouble with their ear, nose, and throat. And normally they, in the absence of a specialist doctor for ENT, then the ENT nurse does his or her own consultation, has their own, they have their own units. ENT doctors are not that common, so the ENT nurses do their own thing. They are autonomous, they are their own bosses, unless in hospitals or facilities where there are specialty doctors, then they work with them. So they do consultation on ENT problems, give medication and all. The next one is the ophthalmic nurses. So ophthalmic nursing is the same as eye nursing, and just as I said for the ENT nurses, ophthalmic nurses also work in the absence of optometrists. They work on their own, they do their own consultation, eye consultation, give medication, and where there is a need for referral, they will refer to a higher level. Another type of nurse will be the dental nurses. So these ones take care of the mouth, teeth, and everything in the mouth, all the issues that you have with your mouth. But with dental nursing, what I've seen is that we have a lot of dental doctors, either dental doctors or dental physician assistants. So they work together. Mostly, I've never met a dental nurse alone in her unit. Mostly there is a doctor or a dental PA in that unit. So they work together. And she also does consultation on things concerning your dental health or oral health. Another one will be hematology nursing. Hematology, anytime you hear anything hem, it means it's blood related. So these nurses are nurses for the blood, okay? They take care of any condition that affects the blood, sickle cell anemia and all. They are there to help in management of these cases. And then lastly, I'm putting this one under because it's specific to women, and that is women's health nursing. Okay, so this types of nursing, it's a new program that the Ghana College of Nurses and midwives started this program, and the nurses take care of everything women, okay, from the health of women, especially with the reproductive tract and all the conditions that come with being a woman, all the cancers, all the infertility issues, and all these nurses take care of those people alongside the doctors, OBGYNs, and co. Now, when we come to the specialties that are focused on one area of care, that is where we have a lot of specialties. The first one will be critical care nursing. So critical care nursing is for, like the word critical, patients who are in critical conditions. And normally these nurses, you find them in the ICU or intensive care units, taking care of very sick patients who sometimes are even unconscious or in a coma that need care. And they try to manage these people to bring them back to health. Then we have perioperative nursing. Perioperative nursing are the nurses that you find in the operating theater. So they assist the surgeon when they are doing operation. She will be handing the forceps and things to the doctor, keeping record of all the instruments that they are using, suctioning when they, oh God, I love perioperative nursing. Yes. So yeah, that is perioperative. It's like assistant mechanic to the human body. I love it. Then we also have accident and emergency nursing. So like the word accident and emergency. So these nurses work in the emergency units where patients are rushed in. There's been an accident, they are rushed in. So accident and emergency is like papa, who is bleeding? Let's stop bleeding. Who is not breathing? Who is not breathing? Whose circulation is cut? Like someone who can think very fast on their feet and do things fast to save people's life. Like that is accident and emergency nursing. If you've ever been to an accident and emergency and you've seen patients rushed in, you get the picture of what I'm talking about. Then we have the nurse anesthetist. Nurse anesthetist or anesthesia nursing is where you help put patients under anesthesia during operation. So you work with the anesthetist, anesthetic. These words, orthopedic, anesthetics, prosthesis, they always chop my mouth, but you get what I'm saying. Since I've already mentioned orthopedics, yes, we also have orthopedic nursing, and these nurses take care of people who need orthopedic support. Ortho is more about alignment and keeping the body in alignment. It has to do with bone, bone arrangements. When there is fracture is when your bones break and then they try to put it together, put some screws in there to make sure that you are able to walk again and all of that. That is orthopedic nursing for you. Another area of care where nurses can specialize is pediatric nursing. So pediatric nurses are the nurses who take care of children. And yeah, they are special. A child who is sick needs special attention, and special people who are trained with a lot of patience and understanding to handle them, because some of us cannot handle sick children, I tell you. So these people are trained specially to attend to children when they are sick. And their sister program is neonatal intensive care nursing. They take care of the newborns and deal with any issues they have. It's an interesting program. I've worked in the NICU before and I like it, except for the fact that it's also emotionally draining. Like NICU and pediatric nursing, you need to be emotionally I don't know how to put the word. You have to be strong emotionally because babies die, parents lose their children, and it's heartbreaking to see. And it's also very fulfilling when you see a baby or a child that was very sick brought in and that child is walking home. The common ones that you see and you like, your spirit is feeling good, is when you've taken care of preterm babies and they survive the preterm stage and pull through and they go and come back to visit you. Oh my God, it's something. But you have to be emotionally strong to do neonatal intensive care and pediatric nursing. But yeah, there are also specialties that you can pursue. Then we also have palliative care nursing. In Ghana, it's palliative care, but outside we also have hospice nurses, but normally it intertwines. So palliative care is for patients who have serious illnesses that need management, like they are still trying to nurse the person back to health. But hospice is where there is no hope for that person anymore. Like no amount of drugs you give the person will bring the person back to good health, or even if there are drugs you can give the person, it's like the disadvantages outweigh the advantages of that medication. So then patients like that might choose to not go for the care and just live out the rest of their days and die. So with hospice, you are just taking care. It's like comfort care. You are giving care for the person to go to their maker peacefully. But with palliative nursing, the patient is still critically ill, might have the stage 4 cancer, but you are still giving curative care to nurse the person back to health. So that is palliative and hospice care for you. Then we also have oncology nursing. So oncology nursing is specifically for cancer treatment or cancer patients. So the nurse is there to help nurse the patient during their chemotherapy and their radiative therapy or their surgical treatments and all. It's purely for cancer patients. So you are a nurse that nurses cancer patients, and that is oncology. And so sometimes you find palliative nurses doing the oncology care because they have that training as well, because cancer can be very troublesome. Okay, so then we have 2 new programs that are being introduced. I don't know if it has started running yet. One is infectious disease nursing. So these nurses will manage infectious disease or consult on infectious diseases like COVID. When COVID came, how to manage it and all. Nurses are always a valuable member of the health team. So yes, infectious disease nursing. I know the Ghana College of Nursing and Midwifery is the school introducing this program, but I also look into it more and see if other schools have taken on that program. And then we have another one called GERIATRIC. Yes, old people nursing. And then lastly, we have the nursing tutors. Nursing tutors are the people who teach nurses in the nursing school. So if you have the passion to teach and impact knowledge, if you have the passion to see nurses trained the way you feel like nurses should be trained, then you can be a nursing tutor and impact your knowledge, shape the way nurses are trained. And it's also one cool job. Nurses teach nurses to become nurses. Doctors teach doctors to become doctors. Okay, so if you want to be a nursing tutor, you can be, but you have to be a nurse first to be a nursing tutor. So those are the types of nurses or nursing programs that are being run in the service. But you have to start from the basic level, either certificate, diploma, or degree, any of the basic programs, RGN, public health nursing, mental nursing, before you can build on to the specialty programs. I hope you enjoyed this video. Thank you for watching. Like it, share, and subscribe if you've not done that yet. And I'll see you in my next one. Bye.